Hello guys, my name is Dr. Elizabeth Kolawole and here are my 2 cents on HPV. Today we are going to talk about the elusive human papillomavirus or HPV virus. Let's first give a little anatomy lesson. This is a figurine of female anatomy. It is a model guide, so don't be picky. We have the vulva here. We have the clitoris and urethra up here. We have the vagina here. And then at the base we have the cervix, okay? The uterus is up here. We have the fallopian tubes on the sides, and then there's the ovaries right there, okay? So, HPV is a small double-stranded DNA virus that replicates in the nucleus, takes over the brain of the cell, and starts to reproduce its own proteins. Then, bam, you are infected. Questions you may ask: what does that mean? What are my risks to this disease? How do I get it? What kind of illnesses are caused by HPV? That is what I'm going to talk about in today's video. Human papillomavirus infection of the genitals is the most common sexually transmitted disease in the world. Not chlamydia, not herpes, and not gonorrhea. There are over 200 types of HPV, so be careful, you guys. At least 80% of sexually active individuals are exposed to HPV at least once in their lifetime. Some experts believe that virtually all sexually active adults have been infected with HPV at least once. In women, there has been up to 20 million infections in the US and 5.5 million new infections annually. HPV is on the rise, y'all. In males, anywhere as high as 73% of the male population was found to have HPV at any given time. Question number 1, how do you get it? Well, HPV is transmitted skin to skin, not sperm, not ejaculation, not discharge like most other sexually transmitted diseases, but through microscopic breaks in the skin in which HPV gets into the stem cells of the skin through their surface sugars. It gets into the cell, then goes straight for the nucleus where it starts producing its own proteins. After it is incorporated in its double-stranded DNA into your double-stranded DNA, you are then infected. So if you thought you were safe by using condoms, guess what? You're not. Condoms don't help with this. For the people in the back, you can still get HPV even though you use condoms because it's skin to skin transmission. Question number 2, what puts me at risk to get HPV? Well, let me tell you. For women, the risk is directly proportional to the number of male partners you have and to the number of female partners that he has had. Sex with a new partner is a big risk factor and a stronger risk factor than sex with a long-term partner. Vaginal and anal intercourse is a major risk factor for HPV infections. It appears that female to male transmission occurs at a higher rate than in either direction, and in both ways it is asymptomatic. For my African American sisters, being an African American woman with HPV, you are more likely to contract a cancerous strain, and it is more likely to persist to cervical cancer. For males, what puts you at risk is previous HIV infection, current and past sexual behavior, number of sex partners, absence of condom use, prior STDs, race, ethnicity, and circumcision status. Men who are uncircumcised are at higher risk. One of the highest risk factors is seen in men who have sex with men. Question number 3. What kind of illnesses are caused by HPV? Well, the biggie is cervical cancer. Over 260,000 cervical cancer deaths occur annually worldwide. This is why women need to get those PAPs. This is why we do PAPs to screen for cervical cancer. Virtually all cervical cancer comes from HPV infection. The most oncogenic types are types 16 and 18, but there are more types that cause cancer. Then there's vulvar and vaginal cancer. Remember my figurine? Vulvar and vaginal cancer. There are also non-genital warts. Those are the pesky things on your hands growing up in middle school. Those are thanks to HPV strains 6 and 11. When those strains get from your hands to your genitals, they're called genital warts. But these aren't the cancer strains. Like I said, these strains are strains 6 and 11. These are very annoying and look like cauliflower that can occur in the vagina and anus. You can also get anal cancer, which goes back to our notorious type 16 and 18 strains, which accounts for nearly 90% of anal cancers. Females have a higher incidence of anal cancer than males, but that is beat by men who have sex with men, especially those with HIV. Oropharyngeal cancer, for those who practice oral sex, especially men, HPV can lead to cancer of the oropharynx, base of tongue, and larynx. There is also an illness caused by HPV called recurrent respiratory papillomavirus. It is a benign laryngeal tumor in children acquired during passage through the birth canal of an infected mother with HPV 6 and 11, those genital wart strains. There is also an illness called Bowen's epidermal dysplasia verruciformis and other types of cancers from HPV. Also, penile cancers are caused by HPV. I hope this was an informative talk about HPV. I hope you learned something. Please comment in the comment section if you have questions or any concerns, and I will try to address those as soon as possible. Again, this is Dr. Elizabeth Kolawole with my 2 cents. Thank you and have a wonderful day.